listeners. This is Jabila, and you're listening to MedReach Healthconvo Stories That Heal. Each show of this episode contains stories bound by a common theme, like a person's personal journey through a particular type of medical trauma. Health Convo is a sincere attempt to share the real inspirational stories of individuals who have overcome serious health issues after facing a lot of mental and physical challenges. And also, if you have any health related clarifications, then join with us on MedReach Healthtalk Forum, where you will get most relevant guidance to all kinds of health related queries. And we believe that sharing these success stories will create a community of hope and encouragement. So let's sit back and listen till the end to know about the journey of healing. Today on our show, I'm joined by a recovered COVID-19 patient who is here to share with us about his journey of healing after being infected by coronavirus. So he is gonna explain the path that he had taken to recover from the same. So he'll explain about the treatment that he had availed and about the healthcare facilities and also the biggest fear that he had faced after being infected by the coronavirus. So let's sit back and listen to his conversation. Thank you so much for joining with us, and I'm really happy that you are here to share your journey of healing towards COVID-19. Great. Hi, sir.
Hello, hi.
Yeah, how are you and how are you doing?
Yeah, I'm doing fine now, as of now.
Fine. This is my first question that I want to address today. So, how did you know that you have been infected by coronavirus? So, what is your first symptom?
It was in the first week of September. I developed cough. There was only cough, and it didn't seem to reduce for 2 or 3 days. Usually, when I have cough, within 2 days, it should be off. But this didn't seem to, reduce. So my family suggested I go get myself tested, just to be on the safer side. Though I thought I was a little reluctant, but then they all said no, better get tested. So I went to a center where they were doing a camp for COVID testing, and I went there and got myself tested, and the immediate report said that it was positive.
Okay.
So then I realized I was positive.
Okay. So after you've been finally diagnosed with COVID-19, when did you got yourself admitted into a hospital and how did you approach the Corona Care Center for the admission process?
So the best thing that we did was we were actually prepared. Okay. We had downloaded the this Arogya Setu app and all that, and we had we actually did a study as to if we test positive, what needs to be done. So we were kind of prepared. So we I entered my details into that app, the Arogya Setu app, that I had tested positive. And then we got a call from the government, and we got a couple of calls, in fact. And the doctor asked me for my history and all, and I have a history of diabetes, not current, but a history. So he said, in that case, it's better you get admitted. And I do not have a room with an attached bathroom. So if I have to use the bathroom, although there is a separate bathroom, I need to go through the house. So he said, in that case, it's better you get admitted because the sugar levels would also fluctuate. So to be on the safer side, it's better you get admitted. And at the same time, actually before this thing, we had met in my mommy's place, and she also tested positive at the same time. So we both had tested positive. She stays in a different place. So we were all admitted at the same time and stuff. So after this, the doctor asked me what kind of facility would you like to go for. So there is something that a lot of people miss. The government has given rights for everybody to get admitted under the quota, the government quota. So we opted for the government quota.
Yes.
Because in hospitals and all, we heard that it's very expensive, which we obviously can't afford. So we opted for the government quota. So there are three things which I understood from this. One is you can get admitted in a government hospital under the government quota.
Okay.
Second thing, you can get admitted in a private hospital under the government quota. Third thing is you can get admitted in a private hospital with their charges, with their rates. And this I'm talking about Karnataka. I don't know about other states, but this is Karnataka BBMP. That is the Karnataka government. So we opted for getting admitted in a private hospital under the government quota. So they asked me for the location and all that, and they suggested a hospital, XYZ hospital near my house. So I said, okay, fine, I'll go there.
I'm so intrigued after hearing that you have made a detailed analysis about the different way to approach the healthcare facilities in order to get the COVID treatment. And here we came to know that even the COVID treatment is available at the low cost. Have this virus got transmitted to any of your family members, excluding your mom?
I have a wife and two daughters. So immediately we got them also tested. And I mean, as soon as I got to know that I was positive, I kept myself away, isolated in my house. And then once I got admitted, I sent them for testing. And all three of them tested negative.
It is a good news that they have got escaped from the virus. And what treatment did you receive from the healthcare facility?
Hospital fortunately was very good. It was a single ward, no male and female separate. It was all together. When I got admitted, there were around just two patients. But then that evening itself, the whole ward got full. Okay. So it was, I think at that time, there were about 3 male and 4 female patients. The kind of treatment was just normal. Basically, they tried to keep my sugar under control. And they gave me some kind of maybe vitamin boosters or some I don't remember the names of the tablets, but yeah, it was only tablets. They were checking my blood pressure and my sugars on a regular basis. So this was the only treatment that was given to me.
Good. Apart from this usual medical treatments from the healthcare facilities, have you done any other herbal remedies or kind of exercises or any lifestyle changes in order to boost your body and your health?
Yeah, they had suggested me some breathing exercises, and basic be on naturals, healthy food and veggies stuff.
Let's take into account the breathing exercises as a precaution method in order to boost your respiratory health. So, how long did the worst last and how long were you under quarantine and when exactly did you finally recover?
4 days.
Just 4 days, okay.
Just 4 days. I was okay on the 4th day, so they actually asked. I was actually okay on the 3rd day. So they said I could leave because there were a lot of patients pouring in and they needed beds. So I was requested to quarantine at home and give way for more patients who were probably more serious.
So what is the biggest fear that you have been faced after knowing that you have been infected by the coronavirus?
The biggest fear that many people, including me, had was getting a bed in a hospital and getting the treatment and paying for it. This is probably, I don't know about now, but at that time, I mean 2-3 months back, everybody had this fear. How do we pay for this? Because the media had shot out so many issues regarding people not being able to pay, and the awareness was very less that the treatment can be availed for free in the government. So that was the biggest fear. But then when we did all this research, we got to know that yes, even we can get the treatment for free, and that's exactly what we did. So this was the greatest fear. And the other fear is once you see, this is a disease that has not happened in our lives, at least something like this has not happened in our generation. So once you come out of the hospital, how will the how will the your neighborhood, or how will people around you take it that you have been positive and you're amongst them? So this was also a fear, that how will you be accepted.
Yes, it is quite true because it's been 10 months, but still people are not ready to accept the fact that it is, and still people are not aware about the different kinds of program that government is providing and for this COVID-19. But I think you have made a better decision in getting the COVID treatment at a affordable cost. So let's move on. So this is my next question. So I have heard that people down with COVID-19 or those under solitary quarantine have often expressed a real sense of loneliness. How did you deal with it? Or have you experienced any kind of mental illness?
So I developed a kind of keep myself happy types, and I was recording songs, and I was doing a lot of things that I could do in my all whatever little talents that I had. I was sharing on social media. Thanks that the internet was not down. That was the way I could communicate with people. So I was making bringing out all creative stuff, and recording things, singing songs, and so always kept myself active and happy. So that, and also I, after I put it up on social media, I started getting a lot of calls from people asking for help, because once
Yes.
the fear gets into you. Once you test positive, you don't know what to do next. So I was happy to help more than around 40 to 50 people as to what they should do next, where they should get admitted. And many people were not even aware that this treatment can be availed free. So I was able to guide them in that, what app they should download, what kind of settings they have to look up, and how do they avail this facility. So I was able to help a lot of people.
Okay. It's a very kind act that you have helped a lot of people and made them to aware about this, and it is very good of you. And also, actually, government is taking all necessary steps, but it is not reaching to all the people. I think it is my personal opinion. So, what do you think? So, what other decision a government can take and how they can improve in order to make this pandemic under control when it comes to India?
I think the government is doing enough. They are using all the kind of media possible. They're spreading the news, spreading the message through news channels, through radio, through phone.
Yes.
I think they have done their part. It's up to us to take it up. Now they have done enough. So you put the TV on once in 10 minutes, you'll definitely see an ad talking about something like this. Keep yourself, wash your hands, keep yourself away from stuff, social distance. They keep telling this. It's up to us to
So,
follow them.
how did your family react when they got to know that you have been infected by the virus?
Okay, they were definitely shocked.
Okay.
But then that's what I said. The good thing is we were prepared. We sat down and we thought, if we get tested positive, what needs to be done? So we had prepared ourselves.
That's the best of all because you have already been prepared for this unanticipated situation. That's great, actually. Here comes my last question. Finally, as we wrap up, what advice do you have for folks in India? Do you want to share any advice for the people who are in fear of COVID-19 as well as for the people who are listening this?
Yeah. So the first thing is, this is a pandemic that hits anybody. You can't stay away from it. You can't escape from it.
Okay.
It could hit anyone. So the best thing to do is to prepare yourself. Get all your knowledge together, and if you get tested positive, what you need to do, sit down, uh, download the app, see where the hospitals are, what treatment is given for others, what preventive measures should be followed, and prepare yourself. If you get tested positive, what needs to be done. So that will help. So that will not give you, it will lessen the, the shock that comes to you when you test positive. So be prepared. Stay happy, stay positive all the time. It will eventually, it will pass. Okay. Even if you, unless there is, of course, when age is a factor, then things get a little worse. But otherwise, it will eventually pass. So just stay positive and keep yourself happy and keep yourself well fed, healthy. I basically, I was diabetic, but then I came under control through not allopathy, but some other treatment, which I think that's a different topic altogether. But only because of my history of diabetes, I was advised admission. But otherwise, things were fine. My sugar levels are fine, and whatever necessary healthy nutrients that need to be taken for diabetic prevention or diabetic control should be followed. I don't encourage too much of medication, but there are a lot of things here. I mean, if you just Google what, I know it's not good to Google and find out, but then there are some genuine methods to control diabetes.
Yes, thank you so much, and you have beautifully made into words about the encounter with coronavirus, and I hope you have made like a ray of hope in today's talk. And yes, this will definitely give hope to the patients who are in fear still now. And this was a very informative conversation, and you have beautifully explained about your journey and how you have got admitted and different types of treatment that even from the government as well as from the private side in less cost. So I'm pretty sure your story will give a lot of insights to people who are going to hear this. Thank you so much for joining us today. And we wish you a good, healthy and happy life. And thank you so much for joining with us.
Thank you very much. All the best to you.
Okay, listeners, hope this talk has given you an insight on the COVID infection. Join with us on the MedReach Healthtalk Forum to share your thoughts and be updated. Please stay tuned for more inspirational stories. Stay healthy, stay safe. Thank you.